Scientists in Oxford are hoping to have 1 million doses of a coronavirus vaccine by September and hundreds of millions by the end of the year. They are one of a group of research teams who will receive funding from a new government task force set up to find a vaccine. Meanwhile, the pressure to carry out more tests on frontline staff continues. The Health Secretary says it will be extended to the police, fire and prison service. Our medical correspondent Fergus Walsh reports.
More than 70 scientific teams across the world are trying to do in months what would normally take many years: develop a coronavirus vaccine. One of the leading groups at Oxford University says manufacturers in Europe, China and India are set to produce their vaccine so it's ready to roll out in September if by then it's shown to be effective.
It's pretty clear that the world is going to need hundreds of millions of doses, ideally by the end of this year, to end this pandemic, to let us out of lockdown and ensure we can do that safely. A vaccine is the exit strategy for this pandemic.
The government has announced a coronavirus vaccine task force to help scale up manufacturing and support teams like this one at Imperial College London. At the number 10 briefing, the scale of the challenge and its importance was all too clear.
Producing a vaccine is a colossal undertaking, a complex process which will take many months. There are no guarantees, but the government is backing our scientists, betting big to maximise the chance of success.
When we do have a vaccine, how will you prioritise who gets it first?
Well, first of all, I think we've got to get a vaccine, and that isn't 2 days away, it's not 2 months away. Making a vaccine is a difficult, complicated process. It doesn't only have to work, it has to be safe. I think it's going to be important that we vaccinate in the way that you normally do for these diseases, which is to make sure that the most vulnerable are protected and then to roll out to wider vaccination. But that's some way off.
Until then, community testing of all those with symptoms will be vital to help rein in the epidemic. But the capacity simply isn't there yet. Today, the government announced testing will be extended to frontline police, fire and prison staff. But many NHS workers are still not getting checked.
Welcome to this session of the House of Commons.
A committee of MPs, led by the former Health Secretary, was told Britain should expect further waves of infection and must learn from its mistakes.
Where were the system errors that led us to have probably the highest death rates in Europe? And we have to face the reality of that. We were too slow with a number of things. But we can make sure that in the second wave, we're not too slow. We could see 40,000 deaths by the time it's over.
It is a sobering thought and a reminder that social distancing is the crucial measure that will ensure the epidemic here is brought under control. Fergus Walsh, BBC News.
The government says it is reviewing the evidence about whether the public should wear face masks in crowded places to help stop the spread of the virus. The Mayor of London has called for masks to be worn in public for additional protection, and a growing number of European countries are recommending using them. Here's our science editor, David Shookman.
Popular in Asia before the pandemic, masks are now appearing in more and more countries around the world. The government here is weighing up the options, and the Mayor of London believes we should cover our faces anywhere crowded.
Think about when you're using public transport, if you really have to, or you're in a shop and you can't keep 2 meters apart. Wearing a non-medical facial covering makes it less likely you may inadvertently give somebody else COVID-19.
One reason is that coughs and sneezes can travel much further than previously thought. Another is that people can spread the virus before they have any symptoms. But the government has a serious worry that the best masks, which are vital on the medical front line, will get snapped up by the public.
Here's how you can make your own face covering in a few easy steps.
That's why in the United States, the authorities are urging people to make their own masks. America's top medic showing how.
Then you fold either side to the middle and you have yourself cloth face covering.
An old T-shirt is not going to do a great job of protecting you from the virus, but think of it the other way round. Covering your face with something like this might actually protect others from you. That's because you might be infected with the virus and be passing it on without even realising.
If you're wearing, say, a double layer of cotton mask and you cough and someone's, say, 8 or 10 inches away, then there is a very dramatic reduction in the percentage of virus that's getting to the other person. They still get some, but it's a small fraction of what they would have got if you hadn't been wearing the face covering.
I protect you, you protect me.
The Czech Republic was one of the first European countries to insist on masks, and now many others are following. They could help with the process of reopening factories and offices whenever the lockdown is relaxed. But that'll be a big step, and so far the government has held back from taking it. David Shrookman, BBC News.
The demand for help from food banks has soared in some areas as a result of the pandemic, with many people suddenly finding they have no income. In West London, a hall at the Olympia Exhibition Centre has been turned into a food parcelling centre. Our social affairs correspondent Michael Buchanan reports.
Each box on this makeshift production line represents a family in need. The hall today should have been showcasing country houses to wealthy Londoners. Instead, an army of volunteers are supporting the city's poorest residents. Olympia has donated the area to the local council, Hammersmith and Fulham, and the Foodbank to meet soaring demand.
It's actually quadrupled over the last couple of weeks, so from an average week would be giving out about 110 parcels, feeding or benefiting about 250 people each week. We're now doing pretty much those numbers in a day.
A small survey by the Independent Food Aid Network suggests demand for help has risen hugely by almost 60% between February and March. Foodbanks say many of their new clients are the formerly self-employed and the newly unemployed. Jeremy Simmons says he lost his job in the property sector as a consequence of the pandemic and has turned to the Foodbank for short-term help.
Have you got any coffee, Lee?
Coffee?
Yeah.
Yes,
well, it's a completely different way of life at the moment. So, no, I mean, you work all your life and then something happens and, you have to, it's drastic changes.
At this Foodbank, they've seen a 300% increase in demand. Here, families who need help to feed children who'd ordinarily be in school are a key group needing help.
Some may have been on free school meals, but there's an issue with the voucher system not working. It's limited where you can redeem them.
Both the food banks and their new clients hope and expect this surge will decline when the lockdown ends. The trouble, of course, is that no one knows when that'll be. Michael Buchanan, BBC News.